Hi, hello, good evening, everyone. We are back with another Ask Me Anything session, and today is the 70th Ask Me Anything session. And we have a very young and dynamic doctor from Gujarat, Dr. Molina Patel ji, with us. She's a great doctor, and she's been practicing at Akanksha IVF and Research Center in Anand, Gujarat. They have great talent there. If you happen to be around Anand, Gujarat, you should visit this center. We are very happy to have you, Dr. Molina ji, with us. She's also an aesthetic gynecologist and an infertility expert. So today she's going to explain about how we can deal with the stretch marks in the pregnancy. She'll also give some tips to how to face them and how to deal with them. So not waste much time. Over to you, Dr. Molina ji. After that, she'll take all your questions. So please post your questions in the comment box, and Dr. Molina ji will take them soon. Thank you, doctor.
Thank you, Ravi, for the kind words. And first of all, good evening to one and all. Congratulations to all the mothers out there who are listening to me today. I would also like to thank Dr. Jaideep Malhotra madam for conceptualizing this app and Ravi for developing this app so well. A lot of queries are being solved by pregnant women sitting at home with a lot of convenience, so it's wonderful. So the topic today is stretch marks in pregnancy. It's a very common topic. In fact, in 2016, more than 11 million women actually searched about the cures and causes of stretch marks on Google. So it's a big thing. So what are these stretch marks? Basically, stretch marks are a scar. They are scars in the skin dermis, which is a layer in the skin, and it occurs most commonly because of the stretching that occurs in pregnancy. Almost 55 to 90% of the women during their pregnancies will have stretch marks. And it can, occur even otherwise also, but today we are focusing mainly on pregnancy. Initially, when these start, they are very small, red-colored, raised, swollen areas. And because there is a stretching of the skin, the underlying blood vessels will start showing up and they appear red. But later on, as the pregnancy progresses, it becomes larger, irregular, and sometimes even violet colored. After the patient delivers, is when the stretch marks become the most ugliest form. So they assume their mature form, they become longer, pale, and actually very shiny and silvery. Now these stretch marks cause a lot of cosmetic concern, burning, itching, mental as well as physical discomfort to pregnant women. These generally start after the 6th month when there's actual stretching, but there's no definitive rule for this. And it can occur, on the breast roots, it can occur on the abdomen, on the lower part, the thighs, hip area, etc. Now, who develops these stretch marks? So there's no fixed rule. Anybody can develop stretch marks, but there are a few risk factors identified. Mainly Asian women, young girls in their early 20s with a family history, with a history of consumption of a lot of alcohol before getting pregnant, a low vitamin C in their diet, and most importantly, excessive stretching or excessive weight gain in the baby and in the mother can cause this. So most importantly, it's the hormones that play in pregnancy that cause stretch marks. So whenever there is pregnancy, there is stretching of the skin, and there is a layer called dermis in the skin where there is collagen and elastin fibers, and these fibers get disorganized. So even after the mother delivers, there is some repair mechanism naturally that occurs, but more or less it always remains disorganized. So your stretch marks will always remain with you for life, but you can do certain things in order to decrease them. So what are the treatment options that are available? So way back in the 16th century, Egyptians, and there are a lot of texts also that say that people used to self-abort the pregnancy to preserve, the pristineness of their body. But now, thankfully, there are a lot of modalities that are available. So because we know that there is a disruption of the collagen and the elastin in the skin, any treatment modality that increases the blood supply, the elastin supply, the collagen content, the hydration, the anti-inflammatory properties of the skin is going to actually help and affect reduce the appearance of the stretch marks. So when it comes to pregnant women, most commonly as doctors and even the women, they self-learn from Google and they actually apply a lot of things from their kitchen, considering it to be safe in pregnancy. So most of them, they apply lemon juice or egg white or potato juice or apple cider vinegar, etc. And these may be effective, they may not be effective, or they may be very slowly effective. We don't know. But actually, there are no studies that, or rather very few studies that evaluate these products from the kitchen. Only few studies that say that almond oil, olive oil, and cocoa butter actually has an effect by about 20 to 30% on the intensity of the stretch marks. Mainly it does moisturization, and that is how it reduces the appearance. But there is no role on these modalities and how they prevent the appearance of new stretch marks altogether. So there are about a few other topical applications that are available. Most commonly is called Centinella asiatica. इसको आयुर्वेदा में जलभ्रामी बोलते हैं और इसका बहुत सारे फायदे हैं और जो टेस्ट किए हैं to actually reduce the appearance of stretch marks. Then there's something called Alpha Stria, which is again a combination cream of hyaluronic acid, vitamin A, C, and E, which has tested results to reduce the appearance. Then there's tretinoin acid creams, that is isotretinoin creams, which is a combination of glycolic acid and salicylic acid. You can use these only after you have stopped breastfeeding, and they assumed and actually they are proven rather to decrease the length as well as breadth of the stretch marks by about 50% in an 8-week duration. Apart from this, coconut oil has proven benefits because it's highly anti-inflammatory, and our good old bio oil application for about 8 weeks at the rate of 6 to 8 times in a day has said to reduce the appearance by 40 to 50%, and there are 2 studies that state this. Apart from this, there are certain advanced treatment options also available, like chemical peels. So chemical peels include either TCA peels or glycolic acid peels, that is trichloroacetic acid peels or glycolic acid peels in the concentration of 15 to 20%, which can lighten them. Apart from this, there's something called microderm abrasion. So microderm abrasion means it's mainly used for the lighter stretch marks. It's basically buffing the most superficial layer of the skin, and it gently exfoliates all the cells and ultimately reduces the appearance of lighter stretch marks. But because it scrapes only the superficial most layer of the skin, it is more effective when combined with carboxytherapy, PRP, etc. And we'll come to that later. The other therapy is called red light therapy. So basically, it's a bulb of red light, and it's like 2 fans. That is how it is designed. You put it over the abdomen at a distance of about 1 foot, and within about 20 to 30 minutes of 20 such sessions, up to 60% reduction in marks is seen. There's more evenness in the skin, and there's lightening because there's excessive blood supply that increases to these stretch marks. The fourth important point is micro needling, and this is by far the most effective. So in micro needling, you have certain needles in the form of rollers or certain pens that come commercially available, and the needles can go at a varying depth of 0.25 to 3 millimeters, and it scrapes the superficial layer as well as it goes slightly beneath the dermis also, and you can then apply a product like PRP or hyaluronic acid or vitamin E, and it does wonders for particularly the darker stretch marks. The last is the carboxytherapy. This is a very, very new therapy in which a thin needle goes just below the skin and you put CO2 gas in the dermis. So it disrupts the collagen and it helps building new collagen. So in this way, the wrinkling is prevented and it actually increases the turgidity, the hydration and the sensitivity of the skin. And of course, then there are certain surgical procedures, but they are not widely applicable, like breast lift, tummy tuck and thigh lift surgeries, which are mainly confined to the celebrities who need a very, very quick result. A last word of caution on a syndrome called PUPS syndrome, that is called pregnancy-related urticarial patches and plaques. And this is a very, very common condition. It occurs in young mothers carrying twins maybe, and most importantly, if the mother is carrying a male fetus. It's the extreme form of stretch marks. There's excessive formation of scratch marks, pimples, and a lot of scarring, and there's a lot of inflammation. And in such cases, you must visit the doctor ASAP. She can give you some cold packs, maybe some blood tests like liver function tests are checked, some tablets to reduce the bleeding like some cetirizine or antihistaminic tablet, and sometimes you may also have to be started on a low dose topical steroid. So in such a condition, you must visit a doctor and she will guide you accordingly. So this pretty much sums up everything about stretch marks, but remember, it has to be tackled in a multidisciplinary approach. Initially, when they are developing or you have just delivered, you may confine yourself to the advice of a gynecologist, but later on, you must also back it up with a skin specialist who will be also taking a targeted approach on these stretch marks.
Thank you so much, doctor, for explaining all possible treatments and all possible information about very common topic. Thank you so much. We have so many people who want to ask their questions to you. Shall we start taking questions?
Yes.
First question, Satyanarayana. His wife is 34th week pregnant. 2 days onwards, there is slightly breast milk leaking, and today they've done the Doppler scan and the cephalic presentation. The presentation is cephalic and anterior, taping in LUS head that crossed LPM grade 2-3. It's a first pregnancy, and the AFI is 20, and the BP is normal, and GTT is normal. Is everything fine?
Yes, so I think she's mainly concerned about the slight breast milk that is leaking at this point of time. Rest, everything looks fine. There is a syndrome called leaky breast syndrome, but if there is only a slight leak in the breast milk, there is nothing to worry. She may apply some cold pack. Make sure that she's not agitating the breast or trying to increase the milk flow, thinking that, she should take it all out. No, that is only going to increase the flow. Wear a tight breast support and don't touch your nipples. If it still increases, or if you feel that it is collecting inside the breast or there's development of lumps, then you must visit your gynecologist or your obstetrician.
Thank you, doctor. All the best, Satyanarayan. Next question, Amit. It's I think about his wife. She's in 16th week pregnant, but when she was 13 weeks pregnant, the anti-scan, there was low-lying placenta with 3.3 mm cervix. One day, they saw 2-3 drops of blood at the time of urine, but it never happened again. Is it normal?
Yes. So at 16 weeks, it's normal to have a low-lying placenta, because the placenta then starts to migrate upwards from the 17th week onwards until the 37th week. Actually, it doesn't move very theoretically, but it is because of the stretching of the uterine wall that the placenta actually moves gradually upwards, and then it doesn't bother. But if she has seen about 2 to 3 drops of blood at the 16th week, she must definitely visit the obstetrician. Certain medicines must be started, and she must take adequate rest, and she must also do regular interval scans to monitor the distance of the placenta from the os.
Thank you, doctor. All the best. Your colleagues, Dr. Yuvraj Jadeja, Dr. Keshav Malhotra, Dr. Kalyani Srimali, and Dr. Nikki Patel, they're welcoming you.
Hi everyone.
Yeah, the next question we take from Charu Gupta. She's 34 weeks pregnant. Can you suggest me, should I go for a normal delivery as a C-section or a C-section delivery? She's having vaginal itching issues. She's 34 weeks pregnant.
So there are 2 things here, Charu. First is that 34 weeks, you stop stressing about the mode of delivery, whether it is going to be a normal and whether it's going to be a cesarean section. I think you must stop Googling and forming preformed notions about this. There is a lot of time, and definitely when you visit your doctor after 37 weeks, a lot of factors will change the mode of delivery. So don't worry at all about that. We cannot predict it. The other thing is, if there's itching, does she have any vaginal discharge? Is it just a superficial itching? Does she have associated burning micturition? What kind of a discharge is there, if any? So you may apply a topical vaginal wash to start with, and that should do most of the pH balancing. If still it is not relieved, then you can go to the doctor and get a per speculum examination done.
Thank you so much, Doctor. चारू जी और थोड़ा डिटेल्स चाहिए इसको और अच्छे से बताने के लिए. And जैसे मोलिना जी ने बताया कि there are so many doctors in the previous sessions also, doctor, they told that don't rely on Google, doctor. We are the doctors who spend 8 to 10 years to, get this expertise. So
yeah, I always tell my patients that unless there's an absolute indication for a particular, for cesarean section, they should not anticipate the mode of delivery, and because it's very disturbing and it's very highly unpredictable.
Right. Yeah. Thank you so much, doctor. Next question, Swati is 11 weeks pregnant. She's having toothache in a tooth which was filled years ago. She's having a history of blood pressure. Can she visit the dentist and get the tooth sealed or filled again?
Yes, of course. In fact, I would like to, with this question of Swati's, I would like to emphasize the importance of tooth health in pregnancy and overall oral hygiene in pregnancy. Most of the clinics, they have this wonderful practice of, a complimentary and a mandatory oral checkup just when they discover their pregnancy, and that is amazing. As far as Swati goes, she's 11 weeks pregnant and she must visit a doctor. She has finished her first trimester and she must visit a doctor and diagnose, like a dentist, and diagnose what is the etiology of this toothache, and she must do what is need to be done.
Thank you, doctor. All the best, Swati. One second. Next question we take from the handle Leo Baby. She's 32 weeks pregnant. She have gained 12 kgs weight already. How much is expected to be gained in the remaining months? Is it okay? Also, the doctor at 30 weeks reduced the Shelcal prescription from 2 doses to 1 dose, 500 mg.
So if you're 32 weeks pregnant and you've already gained 12 kilogram weight, it's okay, it's perfect, the weight gain is fine. Even if you gain some more weight in the last few weeks, it's okay. Don't need to be stressed about that. You can put on as much as 16 to 20 kgs during the pregnancy, but you don't try and restrict your calories deliberately in an attempt to control the weight gain, because that would be unnatural. So I think just change your eating patterns, make it a healthy diet, and then whatever weight gain has to happen, let it happen, but eating the right foods. And of course, avoid the processed foods that is only going to add up the calories and give you no benefits. At 30 weeks, if your doctor has reduced the Shelcal, it should be okay. Ideally, a recommended daily allowance of 1 gram is required in pregnancy, but towards the end, if you're too tired of taking a lot of medicines, it's okay if you take maybe 2 glasses of milk and then a 500 milligram tab of Shelcal.
Thank you, doctor. Next question by Anusha. How to increase the breast milk?
So this is a very nice question. I think as a part of our Indian traditional practices go, once a female delivers, उसको उसके mothers और mother-in-laws बहुत सारे home-based remedies देते हैं, जैसे कि dill seeds का पानी, coconut का, they churn the coconut and make a mukhwas out of it. They give a lot of methi laddus and all that. So these are all natural galactogogues and they work very well. And I also have a personal experience during my lactation period. If in spite of taking all the natural galactogogues, you're not producing enough milk, that is when you may have to pop up some moringa tablets or some other powders which are available commercially. The most important thing is that you must have adequate amount of calories and lots of water during the lactation period, because you will not even realize every feed is going to drain you of at least 500 kilocalories and dehydrate you a lot more. So make sure that you are eating healthy, eating all the traditional galactogogues, having a lot of water and taking good calories on an excess of 500 kilocalories from what you were taking before during pregnancy, and you should be good.
Thank you so much for giving the home remedies and all the natural, foods to do this, doctor. Thank you so much. Next question, Rashmi. She's 6 weeks pregnant and she has brown spotting from the 2 days. And when she gone through the first scan, they said Saki is only 5.3 mm without a fetal pole. Please suggest what will happen. She's scared.
Okay, so if you're already 6 weeks and you see a sac but there's no fetal pole, you have to follow this up after a week maybe. Don't worry about the spotting right now. Sometimes it is a normal implantation bleed that can occur. But at this particular point of your pregnancy, Rashmi, you may have to keep in mind that this could actually have a not so good prognosis. If the fetal pole doesn't develop even after a week, then maybe you can be diagnosed with a silent or a missed abortion. It is also important to know whether you had regular periods before getting pregnant, because sometimes it can just be a delayed conception and your fetal pole will develop much later than normally would have for a normal 28-day cycle female. So just wait, take your pregnancy supportive medications, take rest, don't get stressed or anxious. Just follow it up with a weekly scan with your obstetrician, and that will give you more clarity on where this pregnancy is going.
Thank you so much, doctor. We wish you all the very, very best, Rashmi ji. As doctor said, please follow these guidelines. Thank you so much. Next question by Jinal. She's 9 weeks pregnant and she started using Nivea cream and Oriflame milk and honey on the skin. Is it okay?
See, Nivea cream as well as Oriflame milk sounds to be like good moisturizers. Honey is a great exfoliant and anti-inflammatory medium. So you should continue to use it. And because you're only 9 weeks at this point of time, you probably not even have any stretching or stretch marks unless you've lost a lot of weight beforehand in pregnancy, or you have gained a lot of weight in these 2 months. But I suggest that, don't overdo it. Wait for some time and you should be okay.
Thank you, Dr. Rinchal.
And also, Ravi, I wanted to add one thing for as far as Rashmi goes.
Right.
She should also get her thyroid levels checked, because sometimes a teenage thyroid can also hamper, your fetal pole to develop.
Thanks for adding, Doctor. Next question we take from Rinchal. She's 20 weeks pregnant, and when should she start applying the stretch mark cream?
She should start from the 24 to 26 weeks onwards. It really depends on how much weight gain you've had and what is the weight of the baby and what kind of skin she is having. But I think from 24 to 26 weeks onwards, it is good.
Yeah. Ravija's question, a little white discharge during the beginning of the pregnancy, is it normal? Also, she's a bit scared about how to make her sac stronger. She's 5 weeks pregnant.
So, some amount of white discharge is always normal during pregnancy. But this discharge is non-irritant, there is no odor, and it doesn't cause any itching or irritation to the mother. So, if your white discharge is having all these properties, Rashmi, it is totally fine.
Thank you so much, Doctor, for the positive word. Next question by Dream Collection. She is 37 weeks pregnant and nothing pain is happening, and the due date is 30th June. She's worried about it.
Why are you worried? If the baby will come when it has to come. You're only 37 weeks pregnant, and just wait for it. There's no way that you can do anything about it. The only thing you can do is certain physiotherapy-related exercises, which your doctor might have suggested to you during the last trimester. Just religiously keep doing that, and just wait for the baby to come. It will come when it has to.
Yeah. Thank you so much for those beautiful words, Doctor. We wish you all the very, very best. Please enjoy your last few moments and also share the pictures of your baby with all of us in the iMumz app. We see so many pictures these days. Thank you so much. Next question by Princess Kakashan. इनका डिलीवरी 5 जून को हो गया है, बट पैर काम नहीं कर रहा. प्रेगनेंसी का 9 months में दोनों पैर सुन और झुंझुने से काम नहीं कर पा रहा था. आफ्टर डिलीवरी भी यही कंडीशन है. नॉर्मल डिलीवरी है, चल नहीं पा रहे हैं.
Okay, so if there is a difficulty or weakness in one of the limbs during pregnancy, it's a restless leg syndrome of pregnancy, which is very common. But I do not understand that after this particular patient, is she not able to walk after the delivery at all? Then a lot of things have to be evaluated. And I think she needs to go to the doctor and check her micronutrient levels, her vitamin levels, maybe see a physiotherapist. And a few more things in the history would be helpful. What kind of a delivery she had? Did she have any trauma in the leg beforehand? When sometimes even if the legs are not tied properly to the stirrup during a normal delivery is when some kind of a dislocation can occur. Or during anesthesia also, if there is a jerky movement of the leg is when some dislocations can occur. But these are all very rare. So I think some clarity on the question would be appreciated.
थैंक यू सो मच डॉक्टर काकशान जी. मोलिना जी ये कह रहे हैं कि थोड़ा और इन्वेस्टिगेशन की जरूरत है, तो आप आपके डॉक्टर से संपर्क कीजिए और इसके बारे में पता कर लीजिए. रोमिका's question, how to reduce water retention and what is the ideal weight gain per month?
So during pregnancy there is a lot of hemodilution. So your blood, if you have 5 liters of blood in the body, it's going to increase to up to 7.5 liters. So normally also there is going to be some retention of water and there is going to be an increase in the fluid volume during your pregnancy, and that is a protective and physiological mechanism that nature has designed. The ideal weight gain per month, so it is broken down into 3 trimesters. It will depend on a lot of factors, but the textbook picture says that there should be at least 1 kilogram weight gain in the first 3 months and then 5 and 5 kilogram weight gain in the next 3 months and in the last 3 months respectively. But it depends on what was the weight of the mother before she got pregnant, what kind of a diet she's taking, what kind of ethnicity and background she's having, and a lot of other factors.
Thank you so much, doctor. Next question by Sweta Sangvi. In which month can we start using bio oil?
You can start using bio oil from 24 weeks onwards, and you can continue it even after delivery till you are lactating.
Thanks, Dr. Survi Khandelwal. I have been using coconut oil throughout my body since the 3rd month of pregnancy. In the 9th month, stretch marks have got worse. What should I do to get rid of these marks?
So, if the normally with coconut oil, I haven't seen stretch marks getting worse. But if you have developed a worsening, then you should stop applying it. It's actually causing irritation to your marks because it's very sensitive, the skin in those areas. So you must stop applying. I would suggest that you visit a doctor or a skin specialist to see whether you are having any allergic symptoms. The best would be to just stop applying anything if it's actually not making a difference and it's actually worsening it. You will only be able to get rid of these stretch marks after delivery, as we discussed. Finish your delivery, finish your lactation, and then all the treatment modalities can be discussed, depending on the characters of your stretch marks.
Thank you so much, doctor. All the best, Surbhiji. Next question. Surbhiji, if you missed, Dr. Molina ji summarized entire everything about stretch mark and the treatment on all possible methods in the starting of the video, so you can go check that also. Next question. Ravija has another question. How to make the sac stronger? Is whey protein safe? She's 5 weeks pregnant.
So sac, there's nothing you can do to make a sac stronger. It's going to depend on the hormonal levels in the pregnancy, mainly your beta-HCG hormones, that is the hormone of pregnancy. But if there are certain issues, that is if she's having history of recurrent miscarriages, she's a mother of elderly age, she has history of a lot of pregnancy losses, and you can be given some additional pregnancy supports in the form of progesterone, blood thinners, and some multivitamins and folic acid, and that you can discuss with your obstetrician. Whey protein, as long as you're able to tolerate it and it can be had at the rate of about 1 to 2 scoops in a day, should be okay. Don't overdo it because it's going to overload your kidneys and cause a lot of hormonal imbalances. So have it in moderation. I would still suggest you to have natural proteins in your diet and maybe some plant sources. So that's it, yeah.
Thank you, Doctor. Charu's question. She's 8 weeks pregnant and there is a brown spotting since last 3 days. It occurs once in a day. The doctor said amniotic fluid is less. Any suggestions to keep things good?
So at 8 weeks pregnancy, if she's having some brown spotting, she should not worry initially. We generally give certain clot stabilizers and certain pregnancy support medications like bufastone, as well as synthetic and micronized progesterones to actually support the pregnancy. If the amniotic fluid is less, it's a form of overcrowding in the gestational sac. So baby appears to be bigger when compared to the sac. Nothing to be done right now. Just keep resting, take your medicines, and keep an interval checkup of this pregnancy. And you should be good to go. There's nothing to worry.
Thank you so much, doctor. Actually, Amit asked a question. 16th week of pregnancy, when 13th week anti-scan, low-length placenta, and 2-3 drops of blood at the time of urine. Is it normal? And you also answered. She wants to confirm again. It didn't happen anytime, so is it okay?
Yeah, it's fine. See, she's only 13 weeks and she has got some spotting right now. We know what is the cause of the spotting. You just have to patiently wait for the placenta to actually migrate up. Meanwhile, you should be careful that you are not actually overexerting or doing anything that is going to actually increase this spotting. So you should rest, take all the pregnancy supports, and keep following up with your doctor. Keep following visits and keep measuring the distance of the placenta from the os for additional reassurance. And even in these lockdown times, she need not even rush to the doctor for that. But if at all she notices a huge blob of fresh blood that comes out, then she must visit the doctor ASAP.
Thank you so much, Dr. Amitji. You can follow all these precautions and also keep yourself relaxed, positive. There is a baby care program designed for you. So all the best. Stay safe. Next question, Soumya Reddy. She's 30 weeks pregnant. She's facing urinary infection. Doctor suggested CS test, and the test results are sensitivity. That's what she mentioned. Is urinary infection, will it affect the baby? And is V-wash safe during pregnancy?
Yes. So urinary infections, if it is controlled in time, will not affect the baby. In fact, it normally during pregnancy, normally just causes you preterm birth, or you can deliver beforehand. But these are all uncontrolled infections. If you have done, that is why your doctor has advised a culture and sensitivity. So a targeted antibiotic will cure it way faster than just beating around the bush. So that is a very, very sensible thing to do, and you will be cured immediately. So there's nothing to worry. Vaginal wash, re-wash, they're absolutely safe in pregnancy, and you must use them.
Thank you so much, Doctor. Soumya, in case if you missed yesterday's session by Dr. Narendra Malhotra sir, so it's all about infection. So he also spoke some good points, I mean, very insightful points. So you can also check that video, yesterday's Ask Me Anything session. It's on YouTube. Next question, actually, Tejal has commented. Thank you so much for commenting, sharing your thoughts, Tejal. She's saying that your thoughts are very insightful, though she doesn't have any questions. She felt like she should, tell you this. All the questions are very wonderfully handled by you. Thank you so much. Indeed, all the questions are very wonderfully handled by Dr. Molina ji. Next question we take from Aru. She is 19th week pregnant. Is it okay to start applying oil on tummy from the 5th month? She bought the Shatavari oil.
Yes. Yes, she can start applying from the 20th month if she wants to. Excessive stretching and considerable stretching rather will only start after your 28th week. Is then when she should actually get to religiously applying it. But if she wishes, she can.
It's a very similar question by Umama. She is 9 weeks pregnant and she have urine infection. Will it affect the baby, and how to cure the infection, how to prevent it throughout the pregnancy? Umama, I also suggest you to watch yesterday's session, and over to you, doctor.
So urine infection in pregnancy is quite common. Actually, it's way more common in females any which ways, whether pregnant or not, because females have a very, very narrow and small urinary tract. During pregnancy, you must make sure that you have plenty of water. Any early signs of vaginal or cervical infections, you must go to the doctor ASAP, so that you don't want to secondarily contaminate, your bladder and your urine. At the same time, frequent urination is also advised. By virtue of nature and by virtue of pregnancy itself, it's a nature's mechanism that she will get a frequency, and that is how her urinary tract remains flushed. But you must consciously make sure that you don't hold or retain urine for a very long time. If you have a history of having a lot of recurrent urinary tract infections, you must inform your obstetrician, and she will keep checks accordingly. Also, in your regular antenatal investigation list, a urine routine micro is always advised, so it always picks up the asymptomatic urine tests. There is also something called asymptomatic bacteriuria, in which you are actually not passing pus cells in the urine, but you have symptoms of urine infection. So these must be discussed with the obstetrician, and you must have targeted care accordingly. And if the urine infection is treated in time, there should be no harm to you or your baby.
Thank you so much, doctor. Next question by Richa Chawla. She's not comfortable with the TVS scan. The doctor asked her to go for the anti-scan. She's in 11th week of pregnancy. Is there any alternative for the TVS scan? It's very painful for her. The doctor tried TVS thrice.
So this is very common. A lot of times patients are not comfortable with transvaginal scans. That is perfectly fine. At 11 weeks, the doctor should be able to assess your and it can be done trans-abdominally also. So there is absolutely no need to stress about it.
Yeah, okay. Thank you so much, doctor. All the best. Next, Neha Khatris. Actually, Akanksha commented that awesome session. She's thanking you, doctor. Thank you so much. She also mentioned that, Teja, you need a haircut. Soon, Akanksha, my mom will definitely like this comment. Thanks for letting me know. Next question by Neha Khatri. Hello, ma'am. What is the best for the stretch marks? What is the best remedy, I guess? And also, she's getting brushes on the breast.
As in stretch marks on the breast?
She mentioned brushes, BRUSHES.
Okay. So for all the things that we discussed in stretch marks, I think personally I have an experience of using tretinoin acid or isotretinoin cream. It's a combination of 20% glycolic acid and 10% ascorbic acid, which does wonders. Bio oil also works very nicely, and coconut oil has also great effects. So you can start all this. Later on, I think personally, I have also experience of using micro needling, so that also gives very good results. So after you deliver, you can start tretinoin, and you can start inquiring about micro needling.
Thank you so much, doctor. Next question. 1 second, I just missed out. Yeah, Neha has another question. She's the baby is in the head down position. She's in 33 weeks of pregnancy. Sometimes the baby moves. Baby movements are less. Is it okay?
So how less is what we need to ask her. Neha, normally a baby should move at least 10 to 12 times in a day, and you must consciously keep a check on it. Sometimes when the mother is not consciously trying to perceive her movements, she may perceive them as less, irrespective of them being actually less. At 33 weeks, the baby's head is not going to go into the pelvis, so it can still move about. So don't worry about that. As and when you progress in your pregnancy, the pelvic muscles will relax, and if your pelvis is adequate, the head will go inside the pelvis naturally, but there is still time. And you must consciously perceive your movements. If you feel that they are too less, then you must go to a doctor ASAP to see if adequate blood flow is going to the baby, and you get your Dopplers checked at the clinic.
Thank you, Dr. Neha Arora's question. She's in pregnancy. She's still feeling frequent urination after certain gaps.
Yes, so Neha, actually at 13 weeks, the uterus has started to increase in bulk. It is now pressing upon the bladder, and actually in the first 3 months is when urinary frequency is very common. You will be relieved of this in the 4th, 5th, and 6th month, and again the urinary frequency is going to come back to you in the last trimester. Don't worry, it's very natural because you're pregnant and the uterus is full of blood and it is pressing on the bladder. That is why it is happening. At the worst, what you can do is try to maintain a bladder diary and evacuate, micturate at regular intervals. But it's natural and don't worry about it.
Thank you, doctor. राहुल चौधरी जी, आपका जो सवाल है वो आप हिंदी में पूछ सकते हैं और मोलिना जी हिंदी में जवाब देंगे उनको. कोई बात नहीं, आप हिंदी में भी पूछ लीजिए. एंड एक्चुअली हमारे यहाँ चेन्नई, बैंगलोर, हैदराबाद से भी काफी ऑडियंस है, तो हम यूजुअली इंग्लिश हिंदी का बैलेंस मेंटेन करने की कोशिश करते हैं ताकि सबको हिंदी नहीं समझ आते. नॉट एवरीवन कैन अंडरस्टैंड हिंदी, सो वी ट्राई टू कीप देम मिक्स्ड. सो प्लीज आप जिनका भी सवाल है हिंदी में पूछना है तो पूछ लीजिए. विल डेफिनेटली आंसर इन हिंदी. नेक्स्ट क्वेश्चन, नेहा. शी इज 6 weeks pregnant. She's married to maternal uncle's son, and the blood group is B positive, and her blood group is O positive. There are no abnormality issues in both the families.
Okay, Neha. So because you married within your extended family, there is no issue regarding blood group. But as and when you progress in this pregnancy, make sure that you consult your obstetrician and get all the necessary antenatal screening tests that are done. These could be in the form of blood tests, or included with certain marker scans. So you must mention this to your obstetrician. This is a positive history in the finding, and keep a close watch. Other than that, nothing to worry.
Okay, thank you, Dr. Neha Khatri is thanking you for the answer. Next, Nandini's question. She's 28 weeks pregnant. The anomaly scan says that fetal minimal B/C pelvic tasis followed up to post-month. Please clear this problem.
So this is basically a positive finding in the anomaly scan. She's 28 weeks pregnant. You must get a fetal medicine opinion regarding this. And most of the times the baby should be fine. Just follow it up with a 3 or 4 weekly scan and see whether it is how the pregnancy is progressing.
Okay. Swati Bishwash, earlier you suggested her to visit the dentist to fill the tooth. Is it okay to visit the dentist in the first trimester? Her follow-up question.
It is always wise to avoid any dental procedures in the first trimester. The second trimester is when they are advocated. So just wait for it to go. Depending on the urgency, the call can be taken and the obstetrician can discuss with your dentist. But if it is not urgent enough, then you can wait for the second trimester, and only then you must get it done. There are a lot of case reports in which missed abortions and sudden abortions have happened because of a lot of manipulation in the oral cavity and secondary infection resulting from that. So better to avoid, but can be discussed.
Thank you so much, Dr. Shambhavi's question. She's 31 weeks pregnant. She's having slight neck itching and head pain. Maybe it is because of the weather change, but in the current situation of COVID, even slightest situations will definitely make you think, yeah, of course, Shambhavi. She had slightly oil food recently. What can she do to avoid the itchy throat and headache?
So Shambhavi, first of all, your neck itching and head pain is, just ignore it. I don't think it should be having any serious consequences. I think you're just overthinking it in these COVID times. So just relax. If the itching is all over the body, it occurs too much in the night. If it's too excessive enough to not make you concentrate on your day-to-day activities, and if the head pain is too much, that is, if you're having blurring of vision or excessive occipital headache that is in the back region, then maybe you need to go to the doctor. Other than that, I think it's mainly because of weather change or some or the other day-to-day lifestyle disturbance that you may be having. In order to avoid itchiness in the throat, I think that was her next question. Make some preventive measures. Don't consume cold water. You can even make a nice paste of honey and turmeric and consume it. It is great for soothing the tract. And have little sips of warm water. And avoid foods that can itch your throat and cause irritation to the throat. Oily food is one such irritant, so avoid that. And if it doesn't still perceive, you can do warm water gargles. And if you develop or run a fever, then that is when you should be going to a doctor or consulting a doctor for some antibiotic. That is the right time to start antibiotic.
Okay, doctor, thank you so much. Next question we take from Sangeeta Solanki. Why pregnant women have stretch marks? It's because we do itching or what else?
So a lot of people, including our mothers and our elderly females in a family, they say कि उसको itch मत करो, ये बढ़ जाएगा. So that is true. Stretch marks normally occur because of scarring and stretching. So when the skin stretches is when the structure of the skin gets disorganized, and these will form permanent scars on the skin. Because of, by virtue of its dryness, there is a natural sensation of the female because there's stretching and there's discomfort and there's some burning. We as mothers are urged to itch in order to give us some local relief. Itching will actually further improve this, the scratch marks. It further increases the inflammation, and that cascade, itch, scratch, itch, mark cascade keeps on going on, and you will not be relieved. So if the sensation of itching arises, make sure that you put a napkin and just gradually rub. You don't aggressively itch. Avoid itching in the first place. You may apply some topical cold packs or cold compress, which will actually numb the area and cause the itching sensation to decrease. Also, sometimes you can start some oral tablets like cetirizine. These are antihistaminic tablets which can be prescribed by a doctor. So the itching sensation decreases and the inflammation decreases. And then, of course, the various topical applications that we discussed can be started.
Thank you so much, doctor. Next question we take from Ruchi Gupta. She's 31 weeks pregnant. This is her first pregnancy. When does the breast milk start to produce? I have gained 3 kgs of weight by now. Is it all okay? The tests and reports are all fine.
So she has gained only 3 kgs of weight and she's 31 weeks pregnant. This is not ideal, but there's also nothing to worry because, as I said, the rate of gain of weight in a pregnant woman also depends on how much was her reserve and store of weight before she actually started. If everything else has been evaluated, then if she has not gained enough weight, that is okay. You must also make note that keep having a healthy diet, maybe a little bit of a calorie-dense diet, because in the last trimester is when she has the potential, she as well as her baby have the potential of gaining maximum weight. The baby can gain up to about 300 grams of weight per week. So you must exploit this wonderful period. After 31 weeks, you're able to eat well and you're able to tolerate most of the foods. So she must start working on this from now till she delivers. Breast milk can start by virtue of the hormonal changes in pregnancy, even sometimes while the woman is pregnant. Nothing to worry and nothing to do about it. Some women have a lot of leaky breasts, and that is, we have to manage it accordingly by visiting the doctor. But effective milk production will start after she delivers. Initially, it will be little thick but highly nutrient dense, which is what we call colostrum. And later on, by the sight, smell, and the sucking of the baby per se, the milk reflex gets very well established and the flow normalizes.
Thank you so much, doctor. Next question we take from Sudha Yadav. She's 11 weeks pregnant. Sometimes she's having severe itching in the back during the night only. What should she do?
So if you're having a lot of itching, just make sure that you are applying something topically, maybe a calamine lotion or some moisturizer mixed along with it. You may even take an antihistaminic tablet at night, say cetirizine, to decrease the itching. If it still persists, then you may get your blood test done. And in the blood test, it is very important to check for cholestasis. That is, your liver enzymes must be checked. And that's about it, yeah. And local allergies if she has any, because it's only confined to the back.
Thank you, Doctor. Soumya is 30 weeks pregnant. The baby's weight is 1.5 kgs. Is the weight normal or should it be more?
At 30 weeks, having a 1.5 kg baby weight is absolutely normal. It's textbook picture weight and it's absolutely normal.
Thank you, Doctor. Next question we take from Monica. She's 35 weeks pregnant and the last time 20 days before the baby's position is in the breech position. Is it possible that baby changed the position earlier or at the time of labor pain? And is normal delivery possible?
So Monica, this was pretty much, my story when I was pregnant. My baby was breech, that is head up, for as long as the 36th week. And it was only later that the position changed and it became vertex, that is head down. So don't worry at all, it will change. Sometimes it may not even change, but try to understand that the baby has accommodated to a particular favorable position in the uterus and you must respect that. If it is your first pregnancy and if, so if it's your first pregnancy, you will not have a vaginal delivery. It is very pertinent and advisable to go for cesarean section. Even if it is your second or third pregnancy, certain factors before you plan a vaginal delivery must be evaluated. What is the weight of this baby? How adequate your pelvis is, etc. Because sometimes, especially in breech deliveries, the body of the baby comes out and the aftercoming head is what gets stuck and it causes a lot of morbidity and complications to the mother. At the time of labor, the position will not change. Okay, so you still have time to know the final position of the baby.
Yeah. Thank you so much for sharing your personal experience also, Doctor. Next question by Shanti. Her amniotic fluid level is more than usual. What can she do?
If your amniotic fluid level is more than usual, just keep a timely watch on it, get regular scans done and discuss it with your doctor. Some causes why the amniotic fluid may be more is if there is any abnormality in the baby. See, normally the baby actually, swallows the amniotic fluid, and a part of the amniotic fluid is also contributed by maternal fluid and the baby's urine. So you must know that the baby is structurally absolutely normal. You're not having any abnormal sugars or the mother is not having any diabetes in pregnancy. And, if other less common causes are ruled out, then you can just follow it up and keep a close watch. If it goes beyond an alarming sign, that is if the AFI becomes, that is the index becomes more than, say 25 or 30, that is when the bells should ring and intervention must be done. Until then, don't worry, just keep following it up.
Thank you, Rick. Ginal's question, she's having green veins on the thighs before pregnancy. It was there after pregnancy. It has increased. What should she do?
So these bleeding veins are actually varicose veins that can occur because of pressure. The pregnant uterus actually causes a pressure on your veins and this obstructs the blood supply in these veins, and that is when the blood collects and the veins start to dilate. Some amount of positional advice, physiotherapy and some stretching exercises will help you, Ginal.
Akanksha ji ka sawal, can ghee with milk be taken in the first trimester?
Yes, absolutely. Up to 1 to 2 teaspoons of ghee can be consumed daily on a daily basis. It has lovely anti-inflammatory properties and it is a very good natural laxative. So it is absolutely nice and normal to consume ghee with milk.
Thank you, doctor. Chandani's question: full body backache and joints are paining after C-section. Can't able to walk because of the pain. How to recover?
So Chandani, you have just had a cesarean section, so congratulations. After a cesarean section is the time when the mother has to repair her body during the lactation period. Make sure that you are taking adequate amount of calcium, that is at least 1.5 grams of calcium per day. Most commonly, the back pain and the body pain is because of a faulty breastfeeding position. Because you are so much into feeding, you normally feed the baby without any back support. So make sure that you are always having good back support. Sometimes because of resting too much or because of stiff muscles per se, you can have a lot of back pain. So make sure that you do get back to doing some stretching exercises, take a physiotherapist advice, take your regular supplements, take milk and have a healthy nutritious diet. You can even go for some massages. Body massages are great, they improve the circulation and they relieve pain in a great way. So go for some massages with some nice warm coconut oil and take adequate rest and you should be fine.
Thank you, Dr. Neha's question: what is the importance of color Doppler test?
So color Doppler is a specialized form of test which we do in ultrasound. It is basically checking how much of blood is going to the baby from the mother's body. And these can be checked at various levels. And depending on abnormality in the color Doppler, the need to deliver the baby or continue with the pregnancy can be established. So you may understand better the results of this test with a doctor sitting one-on-one personally, but it is a very essential test for fetal well-being.
So Neha has a follow-up question. Earlier, Neha talked about marriage in the family. She heard about the injection to be taken if married in relations. Is it true? Should she take it? The doctor asked about the blood groups of both and abnormalities in both families, and she said to take 2 injections. Please suggest.
Neha, I am not sure of any such injection that can be taken in case if you are married within the within your family or there's a consanguineous marriage. It's more about the genes and it's more about the genetic constitution of what your child is going to be made of, and if there are any abnormalities, it should be detected at the level of mother and father itself. There is no such magic injection to prevent any abnormality in the child. So I think there is some confusion.
Thank you, Dr. Perimil Gautam. She's 31 weeks pregnant. She's having itching and slight pain below the navel area since the last 2 days, and also skin below the navel area is becoming loose. Is this any problem? How to get rid of this?
So there are 2 things that can occur, Gautam. At the level of the navel area particularly, when the pregnant uterus stretches, the abdominal muscles, there can be a little bit of stretching and they will just move apart. That is called divarication. That is when the skin around the navel becomes very loose. At this point, you can just, there's nothing you can do about it except some stretching exercises and some support to the abdomen and positional changes. This can be worked out after the mother delivers, after your wife delivers, is when the tone of the muscles can be worked upon and this will go away. If there is pain or this itching is actually if she's going to develop some stretch marks around the navel area. So start applying the topical ointments around it for prevention of stretch marks.
Aru is asking how to suggest something for the dry cough. She's 5 months pregnant.
For dry cough?
Yeah, for dry cough.
I didn't get your question.
Yeah, for dry cough.
Yes. So dry cough, it is important to know what is the etiology, but most of the times it is an irritant dry cough. Sometimes it can even occur because of an acid reflux in pregnancy. It's very, very common. So you must actually rule out with the history and by asking the females, her kind of food she's taking and the timing of the food. You may also use a low dose antacid like a Rantac or a Pantocid tablet. Give some sootheners, throat sootheners or lozenges to suck upon, and this should lubricate. If nothing is available to you, then you can simply take honey. It's a great emollient, it's a great soothner. So just take honey with some warm water, and you can even take ghee and turmeric. So these are some natural from the kitchen remedies for irritant throats. And also there's an excellent Dabur ka, there's a syrup called Honeyta syrup, which is a great soothner for the throat. That can also be tried.
Another question from Monisha. When in their 11th week of pregnancy, she had anti-scan and couldn't see the nasal bone. When will be able to see the nasal bone?
So it is very common sometimes that the nasal bone is not appreciated on the anti-scan. Such mothers normally would get very tense that, my baby is abnormal, but don't worry, sometimes the nasal bone can develop much later, and in the subsequent scans you will be definitely be able to see it. Get a repeat scan done after 1 month and you should be able to see it.
Okay. Jayashree's question is that it's a third pregnancy. 6 months started from today. From past 1 week, she's not feeling good. Certain things are making her emotional and she's crying and not able to control.
Jayashree, don't worry. See, sometimes the mother can be very emotionally overwhelmed in pregnancy. That is just how the hormones are. Especially the progesterone levels can actually get onto you and you can become very, very sensitive to small things. I think just try and change your environment. Maybe read a good book, catch up with old friends, do some meditation, resort to some nice yoga and breathing exercises, talk to your family members, spend quality time with your 2 kids that you already have. Another important thing is, I'm a good believer of Garbh Sanskar, that is certain teachings that you can communicate with your child while you're pregnant. It actually not only does wonders for the baby also, but it makes the mother very emotionally strong. So you can actually, I think iMumz has a good Garbh Sanskar manual. So you can resort to that, and don't worry, it's just a matter of time and this phase will also be over.
Thank you so much, Doctor. We are trying our best to be helpful, throughout the entire journey. You can check out our baby care program, Jayashree. We have exercises how you can talk to your baby, how you can meditate, and there's a calming, relaxing music. Hope they help. And please let us know if you need more help. One last question of the session. Sorry, Abusha. She's 34 weeks pregnant and she's feeling pain in the back, hands, and legs from 2 days continuously. Even sometimes in the vaginal area. Is it common?
Yes, Abusha, this is common. It's because of stretching. These non-specific pains will occur to you in the back, legs, and in the vagina. It's absolutely normal. If this pain becomes excessive, so most of the times this pain will go away if you rest or maybe take a warm bath, or it will go away even before you notice, and it will come back at non-specific intervals. Don't worry. It's because your body is now preparing for a delivery and your hormones are all on the high and your ligaments and muscles are very stretched out. That is why it's happening. Go for a nice walk. It will increase the blood supply and decrease the pain. If the pain is too much, that is, there is an excessive contracting pain that occurs in the back, like how you may experience during a painful, during your dysentery, or there's a lot of tenesmus, is when you should go to the doctor. But nothing to worry.
Thank you so much, Doctor. Last 1 hour has been great. Many people are thanking you. Jinal, Chandani, thank you so much. And also we have Dr. Jaydeep Malhotraji with us. She mentioned wonderful session, Dr. Molina. She was there. Yeah. Thank you so much for talking on such an important topic, which is quite common, and addressing all the questions in a very positive way. Many people are thanking the session. I couldn't read all the comments because of the time scarcity. We wish to have you soon with us again, Doctor. It's a pleasure hosting you and interacting with you.
Thank you, Ravi, and thank you, Jaydeep ma'am, for joining the session. Thank you so much to all the pregnant ladies. Congratulations on your pregnancy, and you're all doing great, and iMumz is doing a great job in creating this awareness.
Thank you so much, and we couldn't take